I'm in the middle of cleaning my bathroom and I want to just talk about this because it's a good dialogue, and this is all love because this is my cousin. But I want to talk about this because I 100% get it. It is terrifying to think of someone to take care of you in an area that they've never cared for before. But I'm going to tell you, most people who are taking care of you at some point in time have had no experience while doing it. Now, I can only speak for nursing, but this is really the same for any medical field. So respiratory, physicians, whatever. A lot of that hands-on experience we don't get the chance to do during school. I think when I was in nursing school, I did like 1 or maybe 2 IVs. And that's pretty much it. You don't give blood while you're in nursing school. You're not even allowed to. Like things like that, helping with procedures, like actually helping, not just standing and watching. You don't get to do any of that when you're in nursing school. So even a brand new nurse right out of school is good. Really, if you go straight into a specialized field like aesthetics, or you're a brand new nurse out of school, the playing field's really easy if you go into a field like the hospital, for example. Now, the difference is actually a seasoned nurse, whether she was in aesthetics or somewhere else, has at least like a medical background. Like if she's a good nurse, like she has an idea, she knows how to chart appropriately. She should be good at patient care, regardless of the fact that her patients were like walking in and out of an aesthetic place. All of those skills should be built, and her adaptability, which is really what's key in nursing, should be very good, because even though you're in aesthetics, things can go wrong. People can have mishaps all the time in aesthetic procedures, which is why it's its own field. But a newbie nurse is going to be really, the difference is, though, if you have a nurse who's been a nurse for 5 or 10 years, but they've only ever worked in another area, they're going to have the confidence that a new nurse does not. And that can actually make or break a situation. Knowing how to remain calm, being open, like with your patients about like, maybe I need to look something up. That actually is a lot better than a brand new nurse who might panic. And all of those things are okay. That's normal for a new nurse, but I'm just saying, like, don't 100% count them out just because they haven't worked at the bedside, because I get it, but you're seeing people all the time and don't even know that they're brand new or that they've only been doing it for a very short period of time. That being said, also, skills are not transferable. They're not. The skills you do on the bedside are not transferable to aesthetics at all. Again, the only transferable skills are transferable everywhere. So that's confidence, just general like communication and knowing how to care for a person as a person, those kind of things. Anything I do at the bedside, doing IVs, drawing blood, giving bed baths. I'm not going to do any of that stuff in aesthetics. So those skills are not transferable to aesthetics, which is why you don't need them to go into aesthetics, but you do want those foundations just for you personally as a nurse. You should want to have those foundations to make you more marketable and to make you more confident as a nurse, but they're not 100% necessary. Just like people talk about, I saw something yesterday where they were like, every nurse should be required to do like rounding as a new nurse and go to all the units. Well, I feel like that's what nursing school is for. Like, I never want to work in the ER. I don't even think the ER is a real place. Like, my aunt only came from ER. I hate the ER. It's so dysfunctional. And yeah, ER nurses are good on their feet. They're terrible at charting. Terrible at charting. Why? Because they don't chart in the ER. And I'm sorry to any ER nurses, you might be a good charter. But for the most part, people in the ER don't chart. They don't have to chart. They're not there that long. They don't really have to do that. That's different. But they're faster on their feet. ICU nurses, completely different. ICU nurses can do a lot of things, but they're used to having 2 patients. 1 to 2 patients, maybe 3. So when they get on the floor and they have to have 7 patients, every unit, every area of nursing, every unit, it's all different. And the transferable skills are being confident as a nurse, having your foundations, knowing how to not panic. Those are the transferable skills. But to people outside of the medical world, have some grace. Have some grace.